In a number of places, we're still facing a very serious third wave. Last Friday, I reached out to Premier Pallister about the extremely concerning situation in Manitoba. I also had a call with Mayor Brian Bowman of Winnipeg. I let them both know that the federal government is ready to do whatever it takes to keep Manitobans and all Canadians safe. As soon as a province asks for more assistance, we're there to help. That's why, in anticipation of Manitoba's official request for additional support to manage the situation, we're preparing to deploy federal health human resources. We're also looking at deploying medical staff through the Canadian Red Cross and sending support from the Canadian Armed Forces.
In response to the recent request from the Government of Manitoba, the Government of Canada is preparing to deploy additional federal health resources, including medical staff through the Canadian Red Cross and the Canadian Armed Forces. The Armed Forces will support vaccine rollout in 23 Indigenous communities in Manitoba. And we are also providing 50 additional interviewers to do contact tracing across the province. The Government of Canada is also prepared to deploy epidemiologists, lab technicians, and increase testing capacity from the Public Health Agency of Canada and Health Canada to respond to needs identified by Manitobans. Since the beginning of the pandemic, we have responded to all 17 requests for federal assistance for Manitoba. The National Emergency Strategic Stockpile has allocated over 37 million units of personal protective equipment, vaccine ancillary supplies, and other medical equipment to Manitoba, including nitrile gloves, disposable gowns, face shields, N95 respirators, and surgical masks. Manitoba has requested additional biomedical equipment, which the NESS expects to be able to supply.